welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. And you know, we've had a lot of comments, a lot of inquiries relative to genetic diseases or genetic disease screening, counseling, and research. So I said to myself, well, we have some experts in our community, so I might as well bring them up here and let them talk. So we're going to talk about not only the Mathew Forbes Roma Foundation, but we're going to talk to Kevin Roma, who is the president of the Mathew Forbes Roma Foundation. And we're going to talk to Dr. Neal Weinreb, who is the medical and scientific advisor to that particular foundation's board. Kevin, tell me about the foundation, and I certainly know of its intent, but tell the folks what the intent of the foundation is.
Well, you know, this is a very special milestone year for us. This is the 20th anniversary of our organization. It was founded back in 1998 as we approached the year. And it was created as an honor and inspired by Mathew, who was our first child who was born with tay-sachs disease. Unbelievable, a young man who would fight through such incredible adversity that the disease represents. And he really inspired all of us to create something that would ultimately become his legacy. Our mission is education and research of children's genetic diseases of the brain. And that spans from screening and educational programs all the way up to the research to help to find cures and treatments for these diseases.
And Dr. Weinreb, tell me about your responsibilities as an advisor.
Yes, I mean, it's been a privilege and an honor for me to be an advisor to this foundation. I've worked in the area of lysosomal storage diseases, which is a fairly large category of diseases right now, going back to the late 1960s. At that time, I had an opportunity to work with Dr. Roscoe Brady at the National Institutes of Health, who is really one of the pioneers in both the diagnosis and developing of treatments for some of these disorders. And I've had a lifelong interest in it. When I found out that Kevin and the Roma Foundation were active, especially in the screening area, I mean, that attracted me because I had a very early introduction to tay-sachs disease, fortunately not a personal one like Kevin had, but in Brooklyn back in the early and mid-1960s, there was a special ward, in those days they called it a ward, a special ward of tay-sachs children at what was then called the Jewish Chronic Disease Hospital. And part of our education was spending some time over there. So again, I've had a lot of intimacy and even emotional attachment to the issue of tay-sachs disease. So it was a great opportunity to be able to help out here. I provide information and some guidance about some of the research activities that the Roma Foundation engages in. And I've also helped out as a volunteer physician at some of their early screening testing, which has over the years developed into a much more complex and greater enterprise.
Well, Kevin, I know that, if I'm not mistaken, I saw your unit at our employee health fair. Is that correct?
Yes, we have a wonderful partnership with Southeastern University, educational programs and screening programs, working closely with the College of Nursing. We've had the pleasure of honoring Mr. Ron Asif as one of our annual events for the great leadership that he provides to the institution. And with this recent event that we had, by using the tremendous exposure that goes with the employee wellness program, we had tremendous traffic. And what we did is we provided free testing for the first group of people that attended. And what's amazing about it is this testing is over $1,000 value. To provide that to people is very, very much appreciated, of course. But the information is so critical to their future and to their children's future too. So we're very proud to continue to partner with Southeastern on many of the programs, and we can elaborate on those further for you.
Well, that's really wonderful. And I guess you both know that we've, this last year, we've initiated the use of a very comprehensive new research center.
Yes.
A new 240,000 square foot building. I'm very interested in knowing about the the types of screenings that you do, it's just not tay-sachs. It's a,
Yes.
Pardon me?
No, considerably more, yes.
Yes. Well, give us some idea.
So, put it in perspective, when we started our screening program 15 years, which was just after Mathew passed away, around his 8th birthday, we started the South Florida Genetic Testing and Education Fairs. At that time, we delivered a test panel which consisted of 4 diseases, which the American College of Obstetricians and Gynecologists recommended. At that time, the cost to do that was more than the cost I cited before to you, and all you had was exposure or screening on 4 of those diseases. Now, when we look at this, this is what's called a screening for potential parents, right? So they're looking at whether or not they're carriers of the gene that would then be passed on to their children. And so by doing the screening, it was very important because originally when Dr. Weinreb was referring to early days of tay-sachs, they would test for one disease, just tay-sachs, and everybody would feel that that was important enough coverage. When we started our program, we had 4 times as many diseases, and it still isn't enough. And today, we now test for over 220 diseases. And the technology is outstanding in our partnerships that we have with organizations like JScreen, where you can not only do this through a blood test, but you could also do it through saliva. And so where we used to bring people together to a physical location to have the testing fair and the screening conducted, which we did here recently with the Wellness Fair, that gave you a certain access to people. But now, because we have this kit that you can use, that you can order online, we found many of the participants in the testing fair said, I have children that don't live in this area, but I want them to participate. We're able to access them remotely. They can do the test in the comfort of their own home. And most importantly, and I think you touched on in your opening remarks, not just about testing, it's about genetic counseling, it's education of what do these tests mean? And what are the implications of the test, and what are the options that people have? And so a complete spectrum of services is very important, and that's what we've delivered together with Nova Southeastern and our other partners.
That's really to me it's wonderful, because I was just, we just did a show where I said, and I'll say it again, you know, ignorance is pretty much something that you can deal with. It's non-knowledge that is the most difficult thing. Great. Because there is a lot of myth, and you well know in medicine about, well, you know, I'll give you the top myth. I have a sore throat, I need an antibiotic. Yeah. Top myth. I'm just saying that there's the folks that asked for us to talk about genetic screening, and now, of course, we added counseling and hopefully research into the discussion. I think the whole issue of screening, to me, is a marvelous opportunity for us as we enter into a new knowledge health environment.
Absolutely.
Because we are moving quickly. I mean, I don't want to get it. I've said to people, we never talk politics, but I will tell you, when we talk about healthcare reform, I believe healthcare reform started 15 years ago, not based upon some legislative act, because we've changed our way. The medical community has changed their way. They've become more collaborative. They've become more involved with their colleagues. They just don't come in and the patient is theirs. Now they're collaborative, communicative, even the ORs. I want you to refer, Dr. Weinreb, to the changes, because you have a history with NIH and a history of research. Tell me what has happened over these last few years relative to what I would call the citizens' requests.
Well, in terms of screening for genetic diseases, and of course, there's also even increasing movement now to try to do certain screening for mutations and other associations which are associated with complex diseases. like diabetes, hypertension. I mean, that's an entirely other subject, Parkinson's disease, which is another very interesting area of developments, because it turns out that unexpectedly it's actually overlapped. Some of the information on Parkinson's disease has surprisingly overlapped with one of the hereditary diseases, Gaucher disease, that we screen for, and which happens to be fairly prevalent in the Ashkenazi Jewish community. So there's opportunities not only in these rare, sometimes super rare diseases, but there are increasing applications of screening procedures and genetic analysis to common diseases which affect millions and millions of people. But even within the screening for these rarer genetic diseases, there's been a very dramatic evolution, which has been both a blessing, but to some extent has raised many issues. The technology has essentially evolved from doing biochemical screening, testing for a enzyme deficiency, and a specific enzyme deficiency, which required blood sampling usually. Even there's been an evolution where you can now test for many, many diseases with just a single blood spot. Early blood spot testing was for diseases like phenylketonuria, which could be prevented with dietary modification. But now, using mass spectroscopy and a single blood spot, you can actually scan for hundreds, if not thousands, of different genetic diseases. And that's done primarily biochemically. Then, of course, there's the whole area of screening by looking at DNA. And that's become much more complicated over time as well, because years ago, one would look for a specific mutation. Now, because the technology has become so much more effective and the price has come down substantially, we can look at all the genes that somebody has. Most humans, almost all human beings have somewhere between 20,000 to 30,000 genes which affect which proteins they make. But there's a lot of other DNA besides the type of DNA which is associated with genes, and that regulates the genes. And so there's a huge amount of DNA. You can now do, we call whole genome analysis. When that started out years ago, it took 10 years to do one genome. Now you can do that, you can do hundreds of them in a day with the new technology we have, and the price is much better. But the complexity that's introduced by that is we are starting to find many more variations and abnormalities, and we're not even really sure what the pathological significance is. So, for example, if somebody submits a saliva specimen to one of these companies, which do commercial advertising, they may get back what looks like a little telephone book of all of their sequence of DNA, but the real challenge is who is going to interpret that, and can it be interpreted accurately? And I would point out again that these are opportunities for Southeastern and other medical schools. It's estimated now there are probably only about 20% of the positions for genetic counselors are being filled in the United States. And as time goes on, the need for that type of specialty is going to increase exponentially. We've talked about potential doctor shortages, but the shortages in terms of genetic counseling are bad now, and they're going to only become worse over time. And so the academic institutions need to encourage people to go into these fields, because that's probably where the future of medicine is increasingly going to lie.
Well, I can assure you, both of you, that Nova Southeastern University is looking in that direction.
We've taken a very pragmatic approach. Dr. Weinreb is an incredible repository of how rich the science is and how much progress has been made. What it comes down to is, how do we make this practical for our consumers, right? When we got started, we started testing for a certain amount of as I mentioned, tests, that the disease we have. We actually added, you heard the reference to Gaucher disease. Gaucher was a model for what our vision was for this organization. We identify the at-risk, we identify the ability to intervene early with the delivery of these treatments, because they're very aggressive neurodegenerative diseases that we're dealing with, and the quality of life plummets rapidly. So if we can screen and then deliver the therapies and treat, or in some cases our ultimate goal is to cure, so with things like gene therapy, that we have the ability to really make an end-to-end service and solution for South Florida. And we're making great strides. So while we can test for 220, we can't cure or treat all 220, but we are developing a larger subset of end-to-end capabilities. Right now with tay-sachs disease, with our research initiative that we do with on a partnership on a national level, we're approaching going into clinical trials with gene therapy. It has the ability to cure these. We've already seen it demonstrated in preclinical trials, and we have so many families that are anticipating this result. So the ability for you to, and here's how our partnership has tied together more with Nova Southeastern. We want to be able to screen, we want to be able to treat, and for those that we can't treat, we want to be able to deliver outstanding care. And so we're also doing educational programs, scholarships, training programs with your College of Nursing under Dr. Rutherford, which has been just outstanding. It's very progressive, and it really lends itself to not only helping nurses understand the care for the patients, but it's really caring for the family. It's a community-based experience. And we're just very proud of the work that we do together.
You mentioned Mr. Asaph before. Mr. Asaph is really, who is the chairman of our Board of Trustees, is really, I would say, almost singularly responsible for bringing Dr. Nancy Klimas to our institution. She is world-renowned, and she is the director of the Neuroimmune Institute. And there are so many things that are occurring I'm telling you, almost daily, that are new and exciting.
Dr. Weinreb's really a pioneer. He hasn't shared so much of his story, but when we talked about delivering these treatments, from preclinical into clinical, Dr. Weinreb was a pioneer for one of the first treatments for lysosomal storage disease, for Gaucher disease, and now you have a patient registry of over 50 people that you're currently...
Well, just locally, but
right.
We have an actual registry of over 6,000 patients worldwide with Gaucher disease, and that registry has actually been a model for many other registries in the rare diseases that provide invaluable information. In fact, one of the most important aspects of hereditary disease that the public should be aware of is the huge amount of heterogeneity or variation clinically that exists in many of these diseases. Tay-sachs, for example, has typically always been pictured as in the context of a child who develops symptoms within the first year of life and then inexorably deteriorates. Kevin's son was sustained by his and his wife's devotion for an unusually long period of time, but most children with Tay-sachs disease would pass away age 2, age 3 or so. But now, as we've started to do more of these screening and recognize the variability, we're starting to see more and more Tay-sachs patients who have so-called late onset Tay-sachs disease, which actually presents primarily as a psychiatric disorder. We don't know how many people there are diagnosed with some type of mental illness, but who may actually have a true biochemical basis for it. And recognizing that type of a biochemical defect allows one to think of a specific therapy rather than just the use of non-specific psychiatric drug type of interventions. So that's why treatment also becomes so important. People who have a less aggressive course of disease have a greater chance of not being screened for specifically, will then emerge, and these are people that we may certainly be able to help. The very aggressive diseases that infect the brain are harder to deal with because it's possible interventions may have to be started even pre-birth if one is going to avoid irreversible consequences. We've seen that in other diseases for which there have been screening programs. So as I said, we used to think of screening really primarily in terms of preventing disease. If you had two people who were married and they ended up having a child who was affected, which could be detected by amniocentesis or some other prenatal diagnosis, there was the option to abort such a child. Now we're starting to do on a statewide basis, not so much in Florida yet, although we have neonatal screening in Florida, but in some states they've expanded the screening for babies when they're born also to hundreds of diseases. And so allowing early detection. And that chain raises problems about who does need treatment. Some people will never have any serious manifestations of disease their whole life. You don't want those people to get stigmatized or emotionally affected because they're told that they have a, quotes, disease. On the other hand, if we can sort out who needs treatment early and who may not require treatment, this is another challenge that we're encountering in this whole area of screening. So I'm very happy that Nova Southeastern has really, over the years, developed its commitment to a research track. You know, in the early days of the osteopathic school, it was primarily directed at developing physicians who would be out there in the community, and especially primary care physicians. And I was happy that I was able to participate in some of their training in hematology in years past. But I think it is very important to take on this research obligation as well. And of course that fits in very well with the development of the MD program at Nova Southeast too. We've had a flowering of top-notch medical education and research developments in this area as well, and I think that's very gratifying. It's good for the people in South Florida, and it's good for the economy of South Florida.
Well, it's good for the people. That's why we have this show. We're down to the last 3.5 minutes of this show. So, Kevin, tell us if our viewers want to be participatory in supporting the Mathew Forbes Roma Foundation, give us an address or a telephone number or something. Give us an address.
Okay.
Because people might want to write checks. You never can tell. I never ask them to do that, but you never can tell what they're going to do. So
we appreciate that. Probably the best thing to do is to refer you to our website, www.mfrfoundation.org.
Right.
And that will give them access to more of our story, contact information,
right.
and you'll be able, if you prefer, we're located in Boca Raton. Our headquarters are in Boca Raton. Our address, if you'd like, 9858 Glades Road, number 191, Boca Raton 33434. And I really want to reflect on, because I think we've touched on it a lot here, and I think all of us that are sitting around this table should feel a lot of pride about where we are and how we've contributed to South Florida. When Mathew was diagnosed in 1995, there was just there was a dearth of resources to be able to really care for these children and have any kind of hope. And fast forward to where we are 20 years later, with our milestone year for the foundation, and organizations like Nova Southeastern has really become a world-class institution. And we know this because we're the Florida affiliate of the National Tay-Sachs and Allied Diseases Association, the oldest genetics organization in the country, 60th anniversary this year. And we benchmark ourselves as South Florida and relative to the rest of the country and the world, and we should feel very proud about the progress that we're making, the investment that we're making, and that these families that are confronting what we had to confront when Mathew was diagnosed have so much more to be hopeful for and thankful for our work. So congratulations.
Oh, thank you. Thank you for your advocacy. That, to me, advocates are the blessed people that live on our earth. So thank you, Kevin Romer. You're the president of the Mathew Forbes Roma Foundation. And thank you, Dr. Neal Weinreb. You're the medical and scientific advisor for the foundation. I appreciate both of you being here. Let us do something together for these people out here. They're the ones that will be the receivers of all your knowledge and your advocacy. Folks, I always tell you to take good care of yourself, so now I'm going to tell you, don't miss out on the opportunity of taking some screening when it's offered to you, or seek out some screening if you have any beliefs or concepts to the fact that there might be something you might want to know. Please, again, remember, this show is your show, and if you have any questions or you want any answers, there's a telephone number and an email address right here. And remember, I always tell you to take good care of yourself, so this time I'm going to say take good care of yourself and get yourself screened. This show is called Dateline Health. My name is Fred Lippman, and until next time, see you.